Hi, I'm Hilary Russo. Thanks for joining me for the HIListically Speaking podcast. I'm a certified holistic health coach and havening techniques practitioner, lover of great conversation, and of course, clever wordplay, HIListically speaking. So welcome to an empowering place where my guests share their transformational stories of trauma to triumph through health, healing, and humor. It's the ultimate brain candy as we find out who we are, how we got that way, and what it takes to be a happy and healthy grown-up. And be kind to your mind. I'm glad you're here. Fun fact. A few years ago, my kitty, Miss Eliza Doolittle, and yours truly were cast in a national commercial for a pet food brand. Now, during the audition, I was asked one question. Why is it important what you feed Eliza? The answer was simple. I'm a holistic health coach. I care what I put in and on my body, so why wouldn't I consider the same for my baby girl? She's family. There was this dramatic pause in the casting room, which meant one of two things. I either nailed it or I failed it. Well, let's just say this 15-year-old calico is finally paying the rent. So why am I telling you this? 67% of U.S. households and globally over 50% are pet parents. And since the pandemic, those numbers are on the rise. We have a responsibility to take care of our fur babies. It's clear that time with our pets improves our well-being. So improving their health should matter too, right? That's exactly what the essential oil vet, Dr. Janet Roark, is doing, raising awareness about holistic pet health. And since I'm an essential oils advocate who uses them regularly with clients and for my own health and well-being, Dr. Roark has been my go-to when it comes to using them with Eliza. So on this episode of HIListically Speaking, Dr. Roark not only answers your questions, she goes deep and shares her own struggles with mental health and how essential oils not only helped her on her own healing journey, but the animals she treats and loves. Okay, I just have to start this off with a disclaimer because being a vet, there are probably animals roaming around your office, right, Dr. Roark?
Oh, yes. Yes. We have a new puppy wandering around here. So if there's any background noise, I apologize.
I think we will give you a hall pass for this one because we have a lot of people that are very excited to hear from you. Dr. Janet Roark joins me on HIListically Speaking. She is the essential oils vet. And this is so exciting for me as well because I, being a fur baby mommy as well and, a holistic health coach, taking care of my own body, I knew that it was really important that I wanted to find ways to take care of my baby Eliza, who everybody knows, Miss Doolittle right here. And, having you on the show, there are so many questions that came in that people are looking for alternative ways to care for their pets and do so holistically. So thanks for being here.
Yeah, thank you so much for having me. It's such an honor.
Thank you. So I think, there's a story behind Dr. Roark as well. I mean, falling into this work, and it is a falling into, right? We find a love for the work we do. You've been a vet for over 15 years, and you are always looking to find really safe and effective ways to take care of the animals that are your clients' children and also those that are your own, and incorporating essential oils into your practice as well, which is not something that's common, but is becoming more common, thankfully. So first thing I would love to do is for you to just talk about your own story. Obviously, this was something that, like I mentioned, you fell into. How did that come into your own life?
Yeah, so it was weird. Like, I'm not like... I wasn't one of those like vet students when I was in vet school that was like, oh yes, I definitely want to do like acupuncture and get into Chinese medicine and all of that stuff. I was fascinated by all that stuff. But when I went to vet school, I was like, I'm going to be a surgeon. That's what I was going to be. Like, I'm going to do all of the things. I'm going to save all the animals. And as I went through vet school, the stress really, really got to me. And I was working, there were a lot of days that were like 6 a.m. to 10 p.m. every single day, even on weekends, because we had to care for our patients and things like that. And the stress really kind of wore me down over the years. And so when I found essential oils, I was in a really dark place, a really hard place. I was suffering from pretty severe migraines that were stress related. I had seen like a neurologist, done the CT scans, MRIs. I'm like, clearly you are missing a brain tumor because there is no reason I should be having these. And it wasn't. She was just like, it's just stress. And so I was on different medications for my migraines, and those were affecting my liver. There was all these side effects of all the medications I was on. And I was also suffering from severe depression. And I was on some medications for that to help me through that, because I'd actually really struggled with suicide. After vet school, I kind of had reached this pinnacle of like, okay, now I'm a veterinarian. Now what do I do with my life? And the stress just really got to me. And so I was in this place where I was on like, I don't know, 5 or 6 different medications at the time. And a friend of mine invited me to go to a Tex-Mex restaurant, and she was going to talk about essential oils. And I was like, sure. Who says no to queso, right? In Texas, it's like illegal to say no to queso.
Totally.
So we went, we had food. We had margaritas. It was amazing. And she asked me how I was doing with my health. And she introduced me to a little bottle called Past Tense, which is really, really good for headaches. And so I bought a kit to support her, and bought the Past Tense, and I smelled it, threw it in my purse, didn't like the smell of it at all because it was very minty. And I was more of like a, citrus and spice kind of girl. That's the kind of smells I was drawn to when it came to essential oils. And so I threw it in my purse. But then one morning, it was about 9 o'clock in the morning, I was at work working on my computer, and I ran out of my prescription. And so I was like, oh no, I don't have time to run to the pharmacy. What am I going to do? I grabbed that little bottle, put a drop on my temples and across the back of my neck. And my headache went away in like less than 15 minutes. My puppy is running around like crazy right now. I don't know if you can hear her.
Like we said, disclaimer, because
disclaimer,
this is a vet we're talking to. If it's not a child, it's another kind of child, right?
But my headache went away in like 15 minutes, and I was like, this is amazing. And then I started researching it, because I'm like, how is this working when all the Western stuff I've tried so far wasn't? And I was fascinated because there was a ton of research out there. I started on PubMed, and I went to Google Scholar, and like all the research articles I could find in my spare time, that's what I would do. I would just read research articles on essential oils and animals, or essential oils in general. And there was several on animals as well. And really just started using them for my own family, my own health, my own animals. And about 6 months into using them, I had a client who was, it was a horse named Louis, and he had chronic sinusitis. And so we had treated him about every 3 to 4 months with some antibiotics, and his owner was finally at this point like, Dr. Roark, is there something else we can do besides antibiotics? This is just not getting it. I mean, we've been treating him for 3 years. I'm like, we might have to go in and scope. We might have to flush it. There might be a lot of other things we have to do. And so she asked me, is there anything else we can do besides antibiotics? And I said, well, I've been using these essential oils, and there's a lot of studies that show that they might be helpful for this sort of thing. So let's just try it and see what happens. And if it doesn't work, we can always put him on antibiotics tomorrow. No big deal. And so we did. I did about a 30 to 40 minute oil session with him, just applying the oils along his spine. And he loved it. He was just really enjoying the session, and kind of shaking his head every once in a while. And at the end of the session, there was this like giant puddle of mucus underneath him. It was super disgusting and super awesome because his sinus had completely drained during that session. And I just remember driving away from that farm that day thinking, wow, I guess I use essential oils in my practice now. And I haven't looked back. I've absolutely loved.
How long ago was that?
Loved the journey.
How long ago?
That was 7 years ago.
Amazing.
Yeah. And he had one more bout about 6 months later of sinusitis. We did another oil session with him, and that was, 7 years ago, and he hasn't had another one since. So we were in this like cycle of just like treating and then waiting and then treating and then waiting. And the oils actually really helped resolve the issue and helped his body to fight off what it was that was that was bothering him. So
it's amazing.
Pretty cool.
It's amazing to see what we can do with just what the earth provides us, right? And you had mentioned, going back a little bit to your own story, battling with stress, anxiety. As a college professor, I get the stress and anxiety coming from my students all the time. And then as a mental health practitioner, I've started using oils or giving them as samples to my clients as well. And there is such, there's going to that cellular level and being able to really hit both humans and animals in different areas is really powerful. But when you mentioned about your bout with depression and stress and even suicidal thoughts, I mean, we had an earlier conversation about that where you had said that the suicide rate within the veterinary medicine is astronomical. I would never have thought that.
Yeah, it's 3.5 times more than the general population. And we are the number one profession for suicide rate. And it's very sad. There's a lot of reasons for it. Everybody has their own story to tell, but it's something that was quite alarming to me when I realized it, when I read that statistic, and I was like, there has to be a better way. There has to be a better way for our profession. We're a profession of extremely compassionate people who really, really love animals, really love the people that bring the animals in, and we're faced with these, we're fighting death on a daily basis. Basically, we're fighting Mother Nature with everything we have in us, and that really wears on you over time. And I think, there's a high student loan debt. There's clients can be kind of mean sometimes when things don't go their way, when they're hurt because we can't maybe help their animal. Then a lot of times they lash out and take it out on veterinarians, and now with social media, they'll take it out on social media on them, and it'll ruin people's businesses. And it's a really, really interesting world we live in today, and it's surprising to me, but not surprising that the suicide rate is so high, and it is disturbing. And I wish that we had more natural solutions for veterinarians, because we don't take care of ourselves. We spend very much like, in human medicine and things like that. Or even just moms, you pour everything into the people that you're caring for, or the animals that you're caring for. There's just nothing left for yourself. And I think we do need to take some time and just get our mental health back, use essential oils, use therapy, use, all of the things that are available. But it's hard when there's no time and you're like literally working all of the time.
I think it says something that I'd like my listeners to know, that I have such a respect for my vets that I've had in the past, and even those that have helped Eliza in the ER, any other pet that I've had over my time and working with wildlife animals as well. We don't give enough credit. We think the wizard is going to make everything better, right? And animals are like children to us, and our emotions get high. So I would say to listeners, as every vet I've had has been so compassionate, there's so much empathy and compassion with the work that you do, because these animals can't talk back. They can't tell you. They have their own language. And I'm sure as a vet, you learn what each kind of species, how they direct their attention towards you, but not every animal can do that. So holding space for our vets out there, people, think about it, because this is a stressful job. I would have never thought that, doctor. I would have never, ever put veterinary medicine at the top of that. That's not where you want to be. That's,
No, definitely not. And I just, for your listeners that are listening, if you have a veterinarian and you haven't done something nice for them lately, just send them a nice thank you card, a handwritten thank you card. It goes a long way. And if we get one of those when we're having a really, really hard day, I save all of mine in a drawer next to my in my desk, so that when I have a hard day or a really hard client, I can go and look at those and remind myself of all the good clients that I have and all the awesome patients that I've seen. Because one can really make a one bad one can ruin a whole lot of good ones. And so if you have time, go do that.
Drop a note to your vets, everybody. I mean, the little moment of appreciation in our lives at all, anyone, with just people that you care about, but think about the time and attention that you put into that. I mean, these are not just numbers and patients. These are, you do what you're doing because you love animals. Yeah. Really well, thank you for all you do. You know, I wish you were closer. I love Texas. I went to school in Texas. I love it out there.
I love it.
Are you from Texas originally?
No, I'm originally from Michigan. Right. So I went to Michigan State University for vet school. But I met my husband there, not at the vet school. He's not a veterinarian, but we both were at Michigan State at the same time. And we moved to Texas as fast as we could. We kind of got tired of the snow.
And wide open spaces are so much more appealing, right?
Exactly.
Yeah, definitely. So let's move on to some things. I want to talk about, I think there are a lot of questions that we're going to entertain from listeners. And thank you so much for everyone that submitted. If you are enjoying this podcast and if you enjoy what we're sharing here on Holistically Speaking, you find it valuable, make sure you share this with just one other person that can make a difference. And don't forget to thank your vet. But the one thing that you talk about a lot, because essential oils, I mean, they can also be toxic for both humans and animals. You talk about the safety of essential oils. Do you want to get into that a little bit?
Sure. Yeah, it's still the number one question I get, being the voice for essential oils and animals out there. And it's still the number one question I get. And I do have a free safety guide that we'll provide to your folks that are listening. But really, it comes down to people really want to do what's best for their animals, and they want to do it in a safe way. And too much of a good thing can be bad, just with anything, right? Too much ice cream can be bad. It can be toxic to animals. And so we want to make sure that we're cautious, because essential oils are very, very potent and they are very, very effective. And the cool thing about essential oils is we can actually dilute them for animals, especially our dogs and cats, and have them still be very effective. And so my recommendation is always dilute with small animals. You do want to stay away from a couple of specific oils with dogs and cats. That's tea tree oil, birch, and wintergreen. And if you have a cat that has asthma or any kind of respiratory concerns, you'll want to stay away from the mint oils. So peppermint, spearmint, eucalyptus. Spearmint is a little bit safer. It's a little gentler than some of those other super spicy mints. But those are really, really the basics. And then if you're using them aromatically in your diffuser, you want to make sure that you keep your diffuser on a low setting. And leave the room door open so your animals can leave if they so desire, and only put 3 to 4 drops in your diffuser. So a lot of people will put more drops in their diffuser as they start to use oils more and more, because they get a little nose blind to it. But remember that dogs and cats have millions and millions of more olfactory receptors than we do. And so they can smell very, very small amounts of essential oils. So we want to be cognizant of that and really just stick with 3 to 4 drops in your diffuser and you should be safe.
And cats actually metabolize differently than dogs, don't they? I've read that.
They do, yeah. So they lack a liver enzyme that is helpful for really metabolizing a lot of things. So cats are really sensitive to a lot of different types of plants that dogs aren't. They're sensitive to, Tylenol and, a lot of non-steroidal anti-inflammatories that dogs can have that cats can't. And they're also very small in size compared to dogs. Some dogs are very small, but cats are usually around 10 pounds and dogs can be, 100 and 120 pounds. Yeah. So big difference. So you might have a dog that's the same size as a small person, but your cats are not going to be that large typically. So you have to factor in size as well. So
yeah, I think that's what I love about your pet safety download, and also having your own Facebook group, which is how I found you. And actually, I think I found you doing a little Googling, but also being someone that is an essential oils advocate as well, that finding the right person to share this knowledge. And when I came across what you were sharing, I'm like, oh, Thank goodness. I mean, thank goodness there's someone that's not just like pitching it, but they're living it, and you're using them yourself, and you're using them to help the health and well-being of animals in a holistic way. So thank you for that. Also, there's the fact that you also share the dilution rate is really helpful, because that is something that even as a human, we're like, all right, 3-4 drops. That's what they tell you when you whatever brand you use. But that is completely different for an animal. I would imagine what you use for a 6-pound cat, like the one sitting on my lap, is going to be different from, a horse.
Absolutely.
So,
absolutely.
As we know.
So, yeah. And so, I have my little dilution guide in there and all that fun stuff. So
that's really helpful. So folks,
simple.
Just so you know, that will be in the podcast notes so that you can download that from Dr. Roark, the essential oils vet, who's joining us on Hilistically Speaking. Really excited to have you. But I know our folks that are listening are wondering answers to these questions. So I think we should just get to it. What do you think?
Let's do it.
All right, let's do it. So our first question comes from Natalie. She's in Orlando, Florida, and she would like to know a holistic approach to healing to her older dog who has both shaky legs and lipoma.
Lipomas. So for those of you that don't know, lipomas are just little fatty lumps. They're benign, and so they really aren't a big concern, but sometimes they can grow and become quite large. What I really like for lipomas are a combination of frankincense and grapefruit essential oils. And all you have to do is, if you have an empty, like 10 milliliter roller bottle, put 4 to 5 drops of each of those frankincense and grapefruit in there, and then just top it off with fractionated coconut oil or your carrier oil of choice. And you can roll that right on that lipoma. Try to do it 3 to 4 times a day. Consistency is the key with those. They don't pop up overnight and they don't go away overnight, but if you're consistent about it, you can get them to go down a little bit. And as far as the shaky legs, that's really, really common as dogs get older. They get what we call hind limb weakness. And so there are some really good herbs for that. There's some really good oils for that. I highly, highly recommend acupuncture for that. It's quite effective for that particular situation. But a lot of times it's because as dogs get older, they're dealing with, sore joints and things like that. So we want to make sure we support them with nutritionally and with essential oils, which are a nutritional supplement. So you want to make sure your dog's on a really good glucosamine and chondroitin supplement. I like one, it's from NuVet, it's NuVet, called New Joint DS, and it's a really good, very pure glucosamine chondroitin supplement that doesn't have a lot of fillers. I actually trust that lab and how they make their stuff. And then you'll want to add in some frankincense and copaiba are really, really good kind of anti-inflammatory oils that really help with really help with pain and swelling and weakness, and are really supportive of the nervous system as well. So those would be the ones I would use for that particular dog.
Love a little Frankie, king of oils, right? Gotta have frankincense.
Good for everything.
Everything. It's like in the movie My Big Fat Greek Wedding, where they're putting Windex on everything.
The Windex.
We're putting Frankie on everything. Right?
Yes, Frank for this. Frank for that.
I found the copaiba to be really helpful, and frankincense for Eliza because she has arthritis, and I feel like it resonates with her, so she's like my little litmus test, but I'm really careful with her too, because she's tiny. So that's a really good question. Thanks, Nat. The next one comes from Mary. She's in Dallas, Texas. And her question is, her cat has dander. Mackie has dander. And Mackie is also a cat that has a lower, urinary issues, but her coat and dander's like no other. She also has a problem with her pooch, that saggy layer of skin. I'm talking about Mackie, not Mary.
Yeah.
In her lower abs.
Tummy.
I suggested core work, but I guess it doesn't work for cats. No core.
Yes. How about, there is cat yoga. I don't know if you have seen that, but it is so amazing. Yeah. There's goat yoga, but there's also cat yoga where you can do yoga with your cat. So sometimes some cats are more cooperative
I feel like they just show up on the mat. Yeah,
They
the minute
do,
you're on
but
the
you can,
ground.
do stretches with them. It's pretty amazing. So, so there's several things going on there with that kitty. A lot of that has to go back to the foundation of health, which is nutrition. And so when they get that little pooch, that again doesn't happen overnight. It happens over time, and a lot of it has to do with feeding kibble diet, or what. So cats. I'll go there. Why not? So cats are what we call obligate carnivores. So if you look at their teeth, they don't have any grinding surfaces on their teeth. All of them are pointy surfaces. So they actually cannot. Their teeth are not designed for anything other than meat and bone. And so when we feed them kibble or a dry food, that is very, very dehydrating to them. And cats are naturally walk around in a natural state of subclinical dehydration anyways, because they just don't drink a lot of water. And when you're adding a dry food to them, their diet, their body has to reconstitute that into a usable form. And so that actually sucks the water out of their cells to do so if they're not drinking enough water. And this is another reason why a lot of cats end up with kidney failure and kidney disease, in my opinion. But because of that, you're starting to get a little too many calories and too small of an amount of food. And so feeding a species appropriate diet, like a raw food diet, or even a reconstituted dehydrated raw, or just look at the ingredients on your food. And if you look, in the first 5 ingredients aren't meat or bone based, but there's something like even the grain free, like peas or corn or rice or something like that. Those are not things that cats normally eat. And so you really need to switch up the diet a little bit on those. And so that's the foundation of health. And a lot of times, with people, this happens too, but for sure with animals, a lot of their immune system is located in their gut. And so when you have an unhealthy gut, it often manifests itself in skin problems with animals. So like our allergies and things like that. So when you're seeing dry skin, dander, oily skin, things like that, itchy skin, a lot of that has to do with an unhealthy gut, an unbalanced gut. And so addressing diet is number one. So diet, and then of course exercise. You can still exercise kitties. You could just have to play with them a little bit, get a little laser pointer. And then as far as oils go to support the skin, we're going to be supporting it. But again, if you don't address that underlying problem, it's going to continue to happen. But roaming chamomile is excellent for cats with a lot of dandruff. And I like to use a little bit of coconut oil in there to especially if it's dry skin, to help moisturize it again. So you just a little bit of that, rub it on them, and it can help.
Yeah,
brush them out.
I doubt that they're gonna hate the massage, right?
No, they love it.
Anytime there's a lap provided and a couple hands, they're like, bring it on. That's great. That's good advice. Thanks for sharing that. So our next person is Wananda. She's in Spain, and she is actually going to be traveling with her kitty, going back to the Netherlands. And she asked, how do I minimize the stress when flying with my kitty? So, I mean, this is a standard one. I think that's how I found one of my oils for Eliza. But
yes,
yeah.
Absolutely. So we actually have so many amazing stress reducing oils or calming oils. And what I like to do is, what I would recommend you do is that you select some of the calming oils that you have, whether it's lavender or roaming chamomile or calmer or balance, serenity. All of those are really, really good blends. Balance is like my favorite for sure.
That's
and that would
diffusing.
Be the number one. Yeah, the number one that I would absolutely try with her. And what you do is you just introduce the oil with the cap on and let your cat smell it. And if they sniff it a little bit longer, that means they're saying yes, they like that oil, they want that oil. If they turn away from it, they're saying no, that's not the one for me right now. And so introduce the oil, do some self-selection, let your cat choose which one that they're more drawn to. And then intuitively, you can use that, obviously diluted, Balance is already diluted. The Kids Calming Blend is also already diluted. Super great one to use with kitties. You can rub a little bit on her ear tips during the ride. Definitely put it on beforehand, and talk to your vet as well to see if there's any other things that you need. You're probably going to need to get a health certificate anyways. So talk to your regular vet as well. See if there's any other calming things that you can do. But I really like putting a couple of drops of oil on like a towel that goes in their carrier so that it acts as kind of like a natural diffuser throughout the flight. That might help quite a bit.
I use it a lot.
It is going to be stressful.
Definitely
though.
when they're putting them in the carrier or on the way to the vet. I mean, they know. They just know. Animals know.
They do.
But are you okay? Are you saying it's okay to put something like a Balance or something that's been diluted already onto their skin directly? I mean, obviously that little area where there's no hair on the inside, like where you put transdermal medicine.
Yep, that's exactly. It's a really good place to put it. Ears, just on the ear tips, it's a very vascular area, and so it gets into their system really quickly. It's also very gentle, and most animals don't mind having their ears rubbed. So they're just like, oh, a little ear massage. And then it's also a really good place because they're not going to lick it off right away. So with cats, we always worry about that because whatever you're putting on them topically, you can basically assume they're also going to get it internally just through normal grooming procedures.
And I think that's a question that you share with the pet safety as well, because we don't want to necessarily put stuff all over them, like dousing them with oils, just like you wouldn't put lotions on them and things like that, because if they start licking themselves, it's getting into them differently than it is orally, right? So different impact. Great. That's a good question there, Wananda. Thank you for sharing that. And then Michelle had a question. Actually, she had two. Michelle's over in the UK. She has a 15-year-old calico as well, who nods her head and resembles Parkinson's disease. So I guess it's like Tremors. And she's just wondering how to deal with that, and also just seeing what would make a difference, because she has a little asthma, which we touched on that already, and has a thyroid issue. So, yeah.
Oh goodness, that's like your kitty is just a hot mess, girl. Like, what can I say? Really good questions. And so with the head tremors, there could be a couple of things going on. With the age of the cat being a factor, a lot of cats around that age, like 14 to 16, 17 years old, they start to actually lose their hearing. And as they lose their hearing, they can actually get some little mild seizure-like activity or head tremors whenever they hear a loud noise, just because it like triggers something in their brain. And so you want to be really careful with loud noises if that's what's happening. And then once your cat goes completely deaf, then these stop kind of on their own. And so that could be a factor. The other thing that could be going on is some kind of problem with the cerebellum. The cerebellum is responsible for balance. And so sometimes they have like what we call intention tremors, where they like might be going to eat some food and they're like kind of having a hard time finding it, which it kind of resembles that Parkinson's, like what she was saying. So it could be something to do with that, in which case Balance is another really good oil to use for that. And frankincense and copaiba, again, like those are pretty much like, if I only had 3 oils, it would be those 3 oils.
Over lavender? I guess Balance has.
Over lavender. So Balance is a really good, like all-encompassing. But what we're dealing with when it comes to tremors is the nervous system. And so we want to really support the nervous system. And frankincense and copaiba are really, really good for that. The asthma, we talked about what oils to avoid. So, but diffusing, you can absolutely diffuse oils that help open up the airways. Cardamom is a really good one that I really like for that. And lavender is another really good one that is usually pretty safe. And Roman chamomile is another really good one that's really safe for asthma kitties, that kind of just helps with if there's like an allergic component to the asthma. And then what was the last part of that question? There was one more
I
thing.
think she mentioned about the thyroid.
Oh, the thyroid. So we do have some oils that are very supportive of the thyroid. Myrrh, lemongrass, and frankincense are the three that I go to. Remember that lemongrass is very, very spicy, so you'll want to only use 1 or 2 drops in 10 milliliters of carrier oil for that one. But myrrh is absolutely wonderful for cats, and you can just rub it right over the thyroid for that. So.
Oh, that's good to know because Eliza actually has an active thyroid, so I didn't know that. And I haven't really been, I mean, I use medication, obviously. I mean, we have to believe in Western med as well.
Absolutely.
But what we can do to eliminate the amount can be helpful. In fact, I found that when I brought her back to the vet, she found a nice balance with what she was taking, but then her health actually improved because I was doing the balance. I was doing the frankincense. I mean, I diffuse a lot and I use it in my own home as well and on myself. So yes to Michelle, I get it. I have a 15-year-old calico as well with some of the same situations. And I honestly thought it was selective hearing.
They do start losing
That's
their
what
hearing.
I thought it was. You're actually giving it a medical. What's that?
There's some of that going on too, probably.
Yeah, you're giving validation to it on a medical term. And I'm like, really? All this time I just thought she was ignoring me because she's like, look, I'm a cat and you're just supposed to feed me and clean my litter box and love on me. But all right, so you get out of jail free card over there, Miss Eliza. Well, this is great. You answered some really good questions. And by the way, just to remind you, there is going to be a download available for all of you listeners from Dr. Roark on pet safety. You can find that on the podcast page. And also, just if you are listening to this and you're enjoying this and you're finding value during the Hilistically Speaking podcast with myself and Dr. Janet Roark, please share this with one other person. So many people are pet owners in this country and the world. I don't even know what the numbers are. I believe they're higher in the States than they are overseas. I don't know the last projected numbers. Quite frankly, during the pandemic, I think there's been more pet adoptions.
Gone up, yep.
Yes, we love to hear that. So share it with a friend. Let somebody know. You know, we deal with our own ailments, so we have to take care of our fur babies as well, right? So on that note, I like to have a little fun with my guests, and I play a little. I love the look on my.
Games.
I love it. I never tell my guests. I'm like, oh, you haven't listened to my podcast if you don't know this. I do a little rapid fire, and this just an opportunity to see what the guests are thinking about words that you might have said during the podcast, and I throw them out and then just throw back that word association. Imagine you're back in school. Remember, we did the word association. So here we go. Are you ready?
Okay, so just word association.
Oh, yeah. So one word back.
Okay.
I'm going to throw out a word that maybe you said during the podcast or I said, and then you just come back with the first word that comes to mind.
Okay.
No thinking, just doing. Okay? All right, here we go. Stress.
Breathe.
Vet.
Awesome.
Texas.
Awesome.
I had a feeling you were going to go there. Holistic.
Complete.
Animals.
Heart.
Oh, I just want to end it on that. Normally I throw out a few. Yeah, they are the heart, aren't they? They're the heart and soul. Was there anything else you wanted to do with your life besides be a veterinarian?
No, I'm one of those people that super rare, but I knew I was going to be a vet when I was 5. And my dad actually worked for the state vet. So he worked in the wildlife department for the Department of Natural Resources in Michigan. And so I got to work with a veterinarian when I was very, very young, when I went to, work with him occasionally. And I just knew I was going to be a vet my whole life. And so all through high school, I was on the college track so that I could go be pre-vet. In undergrad, I did pre-veterinary medicine, biology, and equestrian studies. So I actually triple majored with a minor in chemistry, and then got into vet school my first try at Michigan State, and then became a veterinarian. And so it was like my whole life I was striving for that one thing. And I think it kind of threw me off a little bit when I finally got it. I was like, now what do I do with my life? I have to
You're like I wasn't expecting that.
I've just been in school my whole life. I don't even know how to function. So it's been an amazing journey. I never would have pictured myself being the essential oil vet ever in a million years. But I'm so thankful for where this life has brought me, and that I did have a semicolon in my life instead of a period when I was going through that really dark time. And that I have natural solutions now, and I'm off all of my medication. So I'm really, really thankful for everything. I'm thankful for you having me on this podcast too.
Oh, thankful for you being here and sharing. And I wish you were here, or I wish I was there so you could be my vet, but you are from a distance because I check in with your Facebook group. You do a live Facebook every Sunday. I do want to mention that. And that gives people an opportunity to ask these questions openly. It doesn't just have to be on Hilistically Speaking, but these were great questions. And you are such a wealth of information, and I appreciate you. I'm sure my listeners appreciate you. I know Miss Eliza Doolittle appreciates you.
So pretty.
I know, is she a beauty? And yeah, thank you for being here, and thank you for sharing your expertise and love of animals.
Thank you so much.
Great news for pet parents. Dr. Roark is sharing a free download on essential oil pet safety with listeners. You can find that link and more about Dr. Roark on the podcast page. And if you would like to work with me personally and learn more about how I can support you with essential oils and how to be kind to your mind with havening techniques, just set up a complimentary discovery call on my website at hilaryrusso.com, and we'll take it from there. You can also drop me a message on social media, Clubhouse, or LinkedIn at Hilary Russo. I'd love to hear from you. Consider passing along this episode of Hilistically Speaking, or any that align with you, to one other person if you think they'll find it valuable. Your support helps me bring awesome guests like Dr. Roark on the show. Hilistically Speaking is produced by Alan Seals with music by Litbone Redding and recorded on Squadcast. Thanks for listening. Hug your fur babies, and as always, be kind to your mind and don't forget to laugh.